Welcome to the Omnidental Podcast.
Glad to be here for this one.
I was reading through the source material we have for today's deep dive, and it honestly triggered a very specific and slightly terrifying visual for me.
Yeah. What kind of visual?
Okay, so picture this. You have a big event coming up, a wedding or maybe a huge dinner party. You want to look your absolute best for it.
Right.
But you look in the mirror and realize your smile is looking a little vintage, a little sepia tone.
I see exactly where this is going.
So you do what anyone would do in 2024. You go to the store and buy the strongest whitening kit you can find.
And you just commit to it completely.
Exactly. You do the strips, the gels, the weird blue LED lights. You endure all that tooth sensitivity, and then you rinse off that final treatment, look in the mirror expecting to see a movie star, and it is a complete disaster.
Let me guess.
Yeah.
The Technicolor smile.
Yes, your natural teeth are glowing. They are blindingly white. But that one crown you got 5 years ago on your front tooth, it hasn't moved an inch on the color spectrum.
It never does.
It's just sitting there, distinct and dark, like a piece of corn in a bowl of milk.
That is such a vivid image. But honestly, it is one of the most common aesthetic crises people face. We actually call it the Technicolor smile, and trust me, not in a good way.
It sounds like a total nightmare. You try to fix one problem and you just create a much bigger, much more expensive one.
You really do.
So today we are going to stop that nightmare before it happens. We're doing a deep dive into a really fascinating guide titled Restoring Radiance, the Guide to Whitening and Dental Crowns.
And we should point out, this isn't just some generic internet advice.
Right.
This comes directly from the clinical insights of Dr. Bilas Poles.
He's the lead over at Omni Dental and MedSpa.
Exactly. And the reason that matters so much is because we aren't just talking about, how to look pretty.
We're looking at the actual science.
Right. We're looking at this through the lens of someone who regularly deals with dental trauma, the structural engineering of the mouth, and the deep chemistry of these materials.
So the mission today is simple on the surface. Can crowns be whitened?
Simple question, yeah.
But I have a feeling the answer is going to drag us into some pretty complicated chemistry.
Oh, it absolutely will. Because we need to talk about porosity.
Yeah.
And we really need to talk about the structural risks of bleaching that nobody ever mentions.
Risks that can actually make your teeth fall out, from what I read.
Yes. And we need to understand how a place like Omni Dental, which is based out in Arlington Heights, Illinois, approaches this puzzle. It's a constant battle of biology versus engineering.
Which is why this matters to you listening. It's not just about vanity. It's about understanding how the synthetic stuff in your mouth reacts with biology.
Exactly.
Okay, let's rip the Band-Aid off. I have a crown. It's looking dingy. I have a bottle of bleach. Can I make the crown whiter?
The short answer, no.
Hey, really? Just a hard no.
Effectively, yes. A dental crown, once it is fired in the lab and cemented into your mouth, is color stable. You cannot chemically whiten it.
Okay, but hang on. This is where I get a little skeptical. Bleach is incredibly powerful stuff. I've seen it turn black t-shirts orange in seconds. I've seen it burn skin. You're telling me if I soak a crown in peroxide, literally nothing happens?
Nothing happens to the color. And to understand why, you really have to look at the microscopic architecture of a natural tooth versus a synthetic crown.
Microscopic architecture. Okay, walk me through it.
Think about your natural enamel. It feels hard like a rock, right?
Yeah, totally solid.
But under a microscope, enamel is actually a crystalline lattice. It's filled with organic fluids and proteins.
Okay.
It has these tiny tubules. It's highly porous. It's basically like a very, very dense sponge.
Gotcha.
So when you drink coffee or red wine, those pigments seep directly into the sponge.
So the stain isn't just on the tooth, it's actually inside the tooth.
Right. And when you apply a whitening agent like hydrogen peroxide or carbamide peroxide, that chemical absorbs into those same pores.
It goes in after the stain.
Exactly.
Yeah.
It releases oxygen-free radicals that break apart the carbon bonds of those pigment molecules. It is a true internal chemical reaction.
Okay, so you're literally blowing up the stain molecules inside the tooth structure.
Precisely. Now let's look at a crown. Modern crowns are typically made of synthetic materials, usually porcelain or sometimes lithium disilicate.
Right.
These are ceramics. They were fired in a kiln at thousands of degrees. They essentially turn into glass.
Glass. Okay, I see where this is going.
They're completely non-porous. They have hermetically sealed surfaces.
So there's nowhere for the bleach to go.
Exactly. When you put bleach on a porcelain crown, there are no pores for it to enter. There are no internal carbon bonds for it to break. It just sits on the surface, wet and completely useless.
That makes perfect sense. It's like trying to dye a window pane versus dyeing a cotton shirt. The shirt soaks it up, but the window just gets wet.
That is the perfect analogy. And you have to remember, this resistance to chemical change is actually a feature, not a bug.
How so?
Well, think about why we use porcelain in the first place.
Yeah.
Because we don't want it to stain.
Oh, right.
If your synthetic crown absorbed color as easily as your natural teeth do, it would look dark brown within a month of drinking your morning coffee.
That would be awful.
We designed them to be impenetrable. But the trade-off is, once that color is baked in by the dental lab, it is permanent. You simply cannot chemically lighten it later.
Okay, but here is where I'm a little confused. I have friends with crowns, and they swear to me that over the years, their crown has gotten darker.
They always say that.
Right. If it's like a window pane, like I just said, why does it look dingy after 5 or 10 years?
That is the nuance here. And Dr. Pohl's guide makes a really critical distinction between internal shade and surface accumulation.
Okay, break that down for me.
The synthetic material itself isn't changing color. The porcelain is still exactly shade A3, or whatever it started as on day one.
Right.
But life is messy. We have plaque, we have tartar, we have red wine residue, tea, coffee. Over time, a film builds up on the outside of the porcelain.
Ah, so it's like dirt on the windshield. The glass is technically still clear underneath, but you can't see through the mud.
Exactly.
Okay, so if that's the case, I can just scrub it off, right? Get some of that trendy charcoal toothpaste or a really stiff toothbrush and just go to town on it.
Please, for the love of your teeth, do not do that.
Why? I'm just cleaning the window.
You aren't just cleaning the window, you are scratching the window.
Yeah.
It's a huge misconception people have.
Really?
Yes. Porcelain is hard, but the glaze on top, the thin, shiny part that makes it reflect light and look like a real tooth, that glaze can be easily abraded.
Oh, I didn't realize that.
Many whitening toothpastes work specifically by being abrasive. They literally have little grit particles in them. If you take that grit and scrub a crown every day, you create micro scratches all over that delicate glaze.
And I'm guessing scratches are bad.
They are terrible because now, instead of a perfectly smooth surface that repels stains naturally,
Yeah.
you have a rough, sandpaper-like surface that actually traps stains.
Wow.
You are literally making the crown get dirtier faster by trying to clean it.
So by trying to fix it at home, I'm actually ruining the built-in stain resistance?
Exactly. You create this vicious cycle where it gets dirty, you scrub harder, it gets rougher, it gets dirtier.
So what is the actual solution then? If I can't bleach it and I can't scrub it, do I just have to live with a dirty, dull crown?
No, you go to the pros. The guide heavily emphasizes that a professional clean, what we call prophylaxis, is the correct method here.
Okay.
A dentist or dental hygienist has special polishing pastes and soft rubber cups that can remove that surface film completely without scratching the glaze.
So step 1 in this whole restoring radiance journey is really just go get a proper cleaning.
Yes. Often, Dr. Pohl's notes in the material that patients will come into the office wanting a full replacement because they think their crown looks old.
Right.
But after a 20-minute professional polish, it looks brand new again. The actual base color hadn't changed at all. It was just dirty.
That has to be a huge relief for the wallet, too.
Absolutely.
But let's play out the other scenario. Let's say the crown is totally clean, it's sparkling,
Yeah.
but it's just dark. Like maybe it was matched to my natural teeth 10 years ago when I was a smoker and drank 10 cups of coffee a day. But now I've quit and I want a bright Hollywood smile.
This is where we get into the strategy the guide calls whitening around the crown.
Which sounds tricky.
It is incredibly tricky.
Yeah.
Since we know we can't change the crown itself, we have to change the environment around it. You whiten the natural teeth to blend in with the crown.
But wait, if the crown is naturally dark and I whiten my natural teeth, don't I just highlight the fact that the crown is dark?
That is exactly the trap. You have to be incredibly careful here.
Right.
Say your crown is a shade A3, which is a very natural, slightly creamy white color.
Okay.
And you bleach your natural teeth to a B1, which is blinding, refrigerator white.
Yeah.
You've completely ruined the harmony of your smile.
It's the visual dissonance.
It's the Technicolor smile effect you mentioned earlier. The human eye is instantly drawn to the anomaly.
So it looks totally fake.
Right. So the expert perspective here is that you absolutely need a uniform appearance.
Yeah.
You can whiten your natural teeth, but you have to stop before you surpass the brightness of the crown.
So you really need to know when to hit the brakes.
You do. And honestly, this is why over-the-counter strips are so dangerous if you have visible crowns on the front of your mouth.
Because you can't control it.
Exactly.
Yeah.
You're doing it in your bathroom mirror with terrible lighting.
Yeah.
You don't realize you've gone too far until it's way too late.
Right. You need a second pair of expert eyes.
Always.
But there's something else in the source material that actually scared me more than just a bad color mismatch.
The bonding warning.
Yes. There was a huge safety warning about the structural integrity of the crown.
This is the part that nobody talks about on social media.
We tend to think of whitening as totally safe, right? Maybe a little temporary sensitivity, but you figure you aren't going to break anything.
Right. People think it's just cosmetic.
But Dr. Poles is raising a major red flag here about the actual glue.
He is. And this is where his background in treating dental injuries and trauma really informs his cosmetic advice.
Okay, explain this to me.
We've already established that the bleach doesn't hurt the porcelain. The crown itself is completely fine.
Right.
But underneath that crown, there is a bonding agent, a specialized dental cement.
The glue holding the fake tooth onto the real tooth stub.
Correct. And that cement is very often a resin-based material. Now, what do you think happens when you introduce high concentrations of peroxide to resin over and over again?
I'm guessing nothing good.
Those oxygen-free radicals we talked about, they can interact with the polymer matrix of the cement itself.
Oh, wow.
Over time, with frequent aggressive whitening, you can actually soften or degrade that bond at the margins, which is the tiny edge where the crown meets the natural tooth.
Wait, so you're not just risking a bad color match, you're risking the crown actually falling out.
Falling out or becoming loose. And a loose crown is a major, major health hazard.
How so?
If that microscopic seal breaks, bacteria can get underneath the crown. You can't brush under there. You can't floss under there.
Oh, that's bad.
So the natural tooth underneath starts to secretly rot, and you wouldn't even know it until the crown falls off with the rotted tooth inside it.
Okay, that is genuinely terrifying. You're just trying to look a little better for a wedding, and you end up needing a surgical extraction.
It is a mechanical failure caused entirely by a chemical process. And this is exactly why the team at Omni Dental is so adamant about professional guidance.
They can see what you can't.
Right. They can look at the specific type of crown you have, the type of cement that was likely used, and tell you, okay, this concentration of gel is safe for your mouth, but that one over there is too risky.
Makes sense.
Or, even better, they can make you a custom whitening tray.
Oh, I saw that mentioned. How does a custom tray help with the glue problem?
They can design the physical tray to stop just short of the crown. So the whitening gel only touches your natural teeth, but is physically blocked from ever touching the crown's margins.
So you literally protect the glue from the chemical.
Exactly. You isolate the treatment.
That seems like a total no-brainer. If you have expensive dental work in your mouth, protect the investment.
Exactly.
Okay, so we've covered cleaning the surface. We've covered careful, targeted whitening around the crown. But what if none of that works?
Sometimes it doesn't.
Right. What if my crown is just ugly, old, and I want a totally new, bright white look that my current crown will never match?
Then you are looking at the final option presented in the guide tool replacement.
Just starting from scratch.
Sometimes it's the only way forward. If the patient wants a smile that is, say, 10 shades lighter than the current crown allows, you simply have to replace the crown.
But there's a very specific order of operations for this, right? I read that you don't just pop the new crown in first.
No, and this is where so many people get it completely backward.
Really?
Yes. If you get the new crown made first, you essentially have to guess what color your natural teeth are going to be after you whiten them.
Which is impossible to predict perfectly.
Exactly. So the sequence is absolutely non-negotiable. Step 1, you whiten your natural teeth to the exact shade you want. You get them to that perfect brightness.
Okay, natural teeth first.
Step 2, and this is crucial, you wait.
You wait? Why wait?
You have to let the color stabilize. Teeth that have just been chemically whitened are dehydrated, which makes them look much whiter than they actually are.
Oh, I had no idea.
You need to let them naturally rehydrate with saliva for a week or two to see what the true, permanent final color is going to be.
That makes a lot of sense. You don't want to match a crown to a temporary shade.
Exactly. And then, only then, is step 3. The dentist takes an impression and makes the new crown to match that new, stable baseline.
You set the target with your natural teeth, then you manufacture the crown to hit that exact target.
Precisely. And this really brings us back to the question of who is actually doing this work. We've been referencing Omni Dental and MedSpa throughout this whole conversation.
Right, and we mentioned Dr. Poles, but I want to talk about the practice itself for a second because looking at their profile in the source material, it is not your typical drill and fill shop.
No, it's quite a bit more comprehensive than that. They're located physically at 305 East Rand Road in Arlington Heights.
Illinois, yeah.
But looking at their patient map, they are effectively the dental hub for that entire northwest corridor of Chicago.
They listed a ton of towns: Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows.
Schaumburg, Wheeling, Des Plaines, Elk Grove Village, they have a massive footprint.
So if you're anywhere in the northwest suburbs, they are the local experts.
Right. And what strikes me about their practice philosophy, and this links directly back to that safety aspect we just discussed regarding the cement, is their focus on being environmentally conscious.
Yeah, I saw that in the guide. They mentioned sustainable practices, which sounds really nice on a brochure, but what does it actually have to do with my teeth?
Well, think about it. Dentistry uses a lot of intense chemicals, solvents, heavy-duty cleaners, mercury in old fillings. A practice that is actively trying to minimize their environmental impact is usually a practice that is hyper-aware of toxicity in general.
That is a really good point. If they care deeply about what they put into the municipal water supply, they probably care a lot about what chemicals they are putting into your mouth.
Exactly. It implies a much more holistic, cautious mindset. And that's reinforced by the med spa part of their name.
They don't just do teeth.
Right. They aren't just looking at teeth in isolation, they offer facial aesthetics too.
Which is incredibly relevant for a smile makeover, isn't it?
Hugely relevant.
Yeah.
A smile isn't just white teeth floating in space. It's how your lips frame the teeth. It's the symmetry of the face, the muscle tone.
Yeah.
Dr. Poles isn't just a mechanic. He's looking at the whole structural picture. And since he has more than a decade of experience and specializes in complex dental injuries and emergencies, he brings that rigorous medical background directly into the cosmetic side.
He knows exactly what breaks, so he knows how to build it so it doesn't break.
Precisely. And they also emphasize using state-of-the-art technology, which is absolutely critical for that replacement crown process we just talked about.
Because you need it to fit perfectly.
Right. If you're replacing a crown to match your specific new whitening shade, you need digital precision. You can't just eyeball it. You need a perfect fit to protect that glue line we were so worried about.
Yeah.
They do everything from fillings to implants with that same precision.
It all connects. The technology, the chemical safety, the aesthetics, it's all one big system.
It really is.
So let's try to boil this down for the listener who is maybe standing in the drugstore aisle right now, holding a box of whitening strips and looking at their crown in a compact mirror.
Put the box down.
Right. What are the big takeaways from this deep dive?
Takeaway number 1. Physics is stubborn. You cannot chemically whiten a synthetic crown. Don't waste your money trying to bleach porcelain. It won't work.
Takeaway 2.
Don't automatically assume it's a permanent color issue. It might just be dirty. Go get a professional polish before you make any drastic, expensive decisions. You might be shocked by how much brightness returns just by removing that surface film safely.
And the big warning, the one that's definitely going to stick with me.
Watch the glue. Whitening your natural teeth is great, but aggressive chemicals can weaken the physical bond of your crowns.
The structural integrity.
Exactly. Do not DIY this if you have extensive dental work. You need an expert referee to tell you what's actually safe for your specific mouth.
And if you are in that Arlington Heights area or anywhere in the surrounding suburbs and you're dealing with this, maybe you have an old crown that looks like a dark cloud in your sunny smile, or you're just worried about that bonding issue, Dr. Poles and his team sound like the people to talk to.
Absolutely. The source material mentions they really prioritize a stress-free environment, treating patients like family.
Which is super comforting if you're nervous about fixing a failed cosmetic job. So if you want an assessment, or you're looking for pain-free living solutions, you can reach them at 847-483-8833.
Let me repeat that. It's 847-483-8833.
Perfect. They also have online scheduling and great photo galleries on their website if you want to see actual proof of their work before you go in. And you can find the patient registration forms there too to save time.
It is definitely worth checking out.
You know, before we sign off, I'm still thinking about that machine concept.
The mouth is a machine.
Yeah. We naturally tend to think of our teeth as these static biological rocks in our head.
Right.
But this entire conversation really highlighted that the moment you get a crown, you are essentially a cyborg.
In a way, yes, you really are.
You have biology, which is the natural tooth. You have engineering, which is the porcelain structure. And you have chemistry, which is the glue holding it all together.
And that is honestly the perfect final thought to leave everyone with. When you introduce synthetic engineering into a living biological system, you have to treat it and maintain it like a complex machine.
You can't just treat it all the same.
No, you can't just throw harsh chemicals at it and hope for the best. Because one chemical might perfectly polish the bumper, but completely dismantle the engine mount.
Wow. One chemical might polish the bumper but dismantle the engine mount. That is literally going on a t-shirt. Oral care isn't just basic hygiene, folks. It is maintenance engineering.
It absolutely is.
Well, that wraps up this deep dive. Thanks for listening, and keep smiling smartly.
Goodbye, everyone.